There's really no better way to understand the experience than to hear directly from a customer who has been in your position and who has lived through the actual process. So that's why I'm really super pleased to introduce Jessica Jones, Quality and Compliance Director at North Country Family Health Center. Uh, so let me just say a few things real quickly about Jessica. She brings firsthand experience, perspectives as a former Athena practice customer who played a direct role in her health center's transition to athenaOne in 2020. She'll be sharing her journey from the decision to make a change through the conversion process and into the continued success she's experienced with athenaOne and the support of our customer success manager. So thank you, Jessica, for joining us. We appreciate you being here. And maybe before we begin with the questions, we'd love to just take a moment to learn more about you and your health center. So maybe could you please tell us about your role, your background, and your health center, and how long have you been on athenaOne?
Sure. Well, thank you, Ken, and hi, everyone. As Ken mentioned, my name is Jessica Jones. I'm the Quality Compliance Director at North Country Family Health Center, which is an FQHC located in very northern New York. We're right in between the St. Lawrence River and the Adirondack Mountains, about an hour north of Syracuse. We see about 16,000 patients a year for medical, dental, and behavioral health services across 5 community-based and 14 school-based sites. We also operate the WIC program in our 2-county service area. I started as a health informaticist at NOCO just a few months after they had transitioned to their very first EHR, which was Centricity Practice Solution at the time, in late 2012. I also helped the practice transition from paper to Viz Dental, their first dental EHR, in early 2013. And continue to manage our HIT initiatives along with quality, value-based programs, population health, compliance, doing a little bit of everything over here, and still overseeing our HIM and EHR work. So I've also led our agency's UDS submission since our first report back in 2013. And then in 2020, we made the decision kind of midway through the year to transition to athenaOne and went live in October of that year.
Yeah, that's fantastic. And maybe, Jessica, you can spend just a little bit of time about discussing a little bit what makes your health center unique.
Sure. Well, we've been serving our community for over 50 years. Our start was really in children's health when local community organizers recognized the lack of well child care in our area for patients between birth and when they started school. So we opened one of the first WIC programs in the country in 1974. We introduced integrated behavioral health services in the early 90s and have operated school-based health centers in our area districts for over 30 years. We have had certainly some difficult financial seasons, including just shortly after becoming an FQHC, but we have persevered and we are in a growth period right now. We just added a pharmacy on site and a new practice location in the past year.
Oh, that's fabulous. So let me pivot now in a few of the different areas of interest. And I think first up is the whole decision making around the conversion process. And my question is, what were the driving forces behind your health center's decision to change systems in the first place? And then how did you go about doing that? Was it a formal process? Did you look at other vendors?
Sure. So we were kind of facing some required upgrades to CPS at the time, and an integrated system with that tool. When we were approached by Athena with the option to move to the flagship EHR product, and this was just a few years, not too long after Athena had kind of taken over the former Centricity product. So we were certainly not planning to make a move, especially kind of during a global pandemic. But the ROI that was presented to us was really key in our decision making. We were moving from a VPN connected kind of virtual server environment to a cloud-based environment that had much higher uptime. So we were experiencing a lot of significant downtime and high cost with operating that environment, and just really saw the improved efficiencies across the board. We had done a rapid performance improvement project with Coleman Associates a couple years prior, and really felt like some of the data that we wanted to monitor as a part of that project to make sure we were meeting those objectives, we just didn't have that functionality in Athena practice. So, encounter closure rates, how long is a patient taking at intake in the exam room with the provider. We were doing all of that manually, and those are functions that athenaOne has built right in. We didn't really look at other vendors. Honestly, at the time, we did a project a couple years earlier where we had investigated another EHR vendor that's very common with other New York State FQHCs, and we really felt comfortable having done that analysis moving forward, kind of knowing what else was out there in the market, moving forward with athenaOne. And, it was early COVID, so our leadership team was meeting daily for hours at a time. And so those conversations and decisions were able to happen pretty quickly.
Yeah, great. Let's talk a little bit about your partnership with Athena during the whole process. So maybe starting with onboarding, how did our teams collaborate with you ahead of the go live and then during the onboarding process? What worked well in onboarding and then maybe what didn't work so well?
Yeah, so we had regular onboarding meetings with all team members to get really high level updates.
Mhm.
And there was sort of the series of subcommittees of groups that sort of specialized in certain components of the onboarding process. So imports and integrations, the RCM was a component, clinical build, data and quality. And so our team really appreciated those subcommittees because it meant that everyone kind of went to where their focus and their kind of skill area was and didn't have to go to everything because that could get really intensive. Um, we did have a great project manager who was really great about having a very detailed project plan, keeping people on task, making sure that everyone knew kind of where things were in process, was very responsive. I think it's important to know that Athena's goal is to train you on how to build and edit the system, how the product actually works. It's your job to translate how that functionality is going to work with your workflows. So there is thought and prep and involvement of your team that goes into that. It's not, the work doesn't all happen in the meeting. So that's something just to be mindful of, I think. Um, we struggled not being able to have a clinician that could really join us for every single one of those meetings. So there was some extra work on our team, specifically with that clinical build, where we had to kind of go back to someone else, explain, um, the rationale or kind of what we were thinking in terms of build and kind of get that buy-in.
Yeah, you started going into it a little bit, but I was going to ask if there are any specific workflows or programs specific maybe to CHCs that you think required special attention during the onboarding process.
Yeah, I think for UDS, certainly capturing some of those registration or demographic specific elements. So, what do we consider as a required field? Might be different than what a private practice without those, reporting requirements would. And then educating staff on best practice workflows for those. How to make sure that we're reporting accurately, documenting accurately. And then on the financial side, there's certainly setups like sliding fee scale, the FQHC specific billing rules that needed to be addressed, make sure that those were turned on for our practice. We did have dental services that was not, there was no athenaOne dental at the time. So we did move to a separate system for that. So really considering the interface and how UDS and financial reporting workflows were going to work, having that kind of bi-directional with an external EDR.
Change is hard, right? No one truly likes change. So I'm wondering, how did you get the staff behind the project and what kind of a difference did that make? Are there any specific lessons learned or what would you do differently that our audience should keep in mind?
Yeah, so we shared our kind of thought planning with our provider team very early on. We had them attend, I think it was a few hours long, honestly, a webinar on athenaOne so they could kind of get acquainted, get a little demo, and ask questions. I think we did have some providers that were really very interested in making a change, who were really very frustrated with our previous system and felt it was really clunky. So once they saw it, they were on board. I think too, we really looked for those change champions at every level. So we're, from providers to MAs, nurses, front desk staff, who would really be positive about the transition, who would, kind of hear what's being whispered in the back and bring that to us so we could address that, or answer any questions that people, maybe didn't bring to the transition team. Um, and then helping people who really want to be super users or who kind of have that skill, who are great at training, who are really good with technology, who are interested um, in knowing a little bit more about the system, going a little bit deeper, and really investing in them to protect their time to make sure they were able to get through all of those, pre-go live training modules, that they could do kind of not just the foundational learning, but build upon that, and then really, elevate them among their team to really be that go-to person. And there are always people who are more change averse. So sometimes we would pull those skeptics in. We'd say, come on, we're going to go, we want to work on this build, and we want to hear what you have to say. And sometimes showing them the secret of the sauce a little bit of like how things are getting built demystifies it, and they feel a part of it and have kind of that safe place to ask questions or to question why you're making a choice, and they get to feel included. And sometimes that's what it is. People are hesitant because they don't feel like they're being heard, and so we just pull them right back and say, you're going to help us, let's work on this together. And that really helped.
Yeah, that's 1,000% a fabulous best practice, and I've heard that from other successful customers is making them part of the solution. I'd love to pivot a little bit to post to go live. So, you know, uh, in the customer success world, we're here to support our customers and to work in partnership to help our customers find their greatest success. And the role of the customer success manager, as I mentioned, is I think really critical to that achievement. Now, your CSM, Christopher, shared that your entire team, your CEO, billing team, clinical team, are all actively involved and work together to ask questions, express concerns, and pay points. And it sounds like you have an established monthly cadence for
Mhm.
performance calls, which is great to hear, along with other ad hoc meetings as needed, which is fantastic. So I guess really my question, and don't worry, you won't get them in trouble, but how has your CSM contributed to your health center's success since transitioning to athenaOne? And maybe you can talk a little bit about those monthly calls and in what ways your CSM is proactive and what does that mean for you?
Sure. And I would be remiss. I know you talked about how, some customers have great relationships with their CMS or CSMs. To not mention our first CSM, Samantha, who has now moved on to kind of the overall FQHC team. She was fantastic. So happy that other health centers are going to benefit from her knowledge and advocacy. But yes, Christopher is great. He does a great job of being data forward, which I think is really kind of across the board at Athena, but really looking at the RCM, the user metrics, that can give us that insight into our practice that we've never had before. We moved to athenaOne. So really looking at, here are the specific data points. Here's kind of where claims are in hold and kind of drilling down into that. Where are dollars sitting that we need to take action, in terms of user metrics, looking at how providers are utilizing the system. Is there someone who's way outside the bell curve in terms of their time that's spent outside of their business hours doing work, and how do we use the resources, whether that's some of the accelerators within documentation or that's that one-on-one coaching, to support that provider. So really helping us kind of dial in. So we're fixing problems instead of spending time trying to find the data just to identify what those are.
Yeah.
And I think CSMs that really understand FQHC models, it is very important. So he really is an extension of our team. He's the person who kind of sits in between Athena and us. And so we really look to his expertise, connections, advocacy. They might not have the right answer right away, but they're going to find it for you.
Yeah, and on that note, we specialize our CSMs, right? With the team of CSMs that supports community health centers is part of a larger team, and all they do is work with FQHCs and community health centers. So agree completely that that level of detailed expertise in the specialty is really, really important. I'm wondering if you could share a few specific instances where Christopher has provided support, or maybe Samantha, where they
Mhm.
helped maybe created a significant impact on your operations. And also, I'd just love to hear your perspective on overall support, the CSC, success community, all the other resources at your disposal.
Sure. So our CSMs have helped us escalate support tickets, share resources with us. Like just recently, shared FQHC best practices calendar, which gives you a breakdown of daily, weekly, monthly, tasks that you should be completing. That covers a multitude of domains. RCM is one that we're really dialing in on right now. So that was super helpful for us with the new RCM director on board. Um, Connecting us with other Athena teams. So for coaching and optimization. So again, talking about like we've got a provider who's kind of falling outside of that bell curve. Let's get them set up with that one-on-one coaching. Or we did a portal and web scheduling optimization project last year. And so helped kind of connect us with that team to get that started. When we were setting up an interface with Exact Sciences, the Cologuard people, to do order and result delivery, Samantha kind of jumped in and helped make sure that project was moving forward in a timely manner, which is really, really helpful. I think the success community has so much information, it can be a little bit overwhelming, but it really is a great resource. I just will plug the FQHC user group, which is really helpful with regular meetings. Customers can go in and ask questions of other customers in that group. Being able to see what other enhancements people have suggested. So I think, talking back to kind of the number of enhancements that are driven by customer feedback is really innovative. You don't really see that at other vendors. So, being able to see what people are suggesting, commenting on that, being able to upvote those, and kind of help those get across the enhancement finish line is really great. Alpha and beta testing is awesome, right? Like being able to be a part of the development process. It's not kind of shrouded in mystery. You can go on and you can see what is in development right now, and you can put your hat in the ring and say, yeah, we'd really like to try that. That's just, it's so great as a customer to be able to have that input. And then with the CSC, there's been some recent updates that I think are really helpful. So when you're typing out your ticket and putting in your issue, it actually will scan the community for potential knowledge articles that are related to it, and it'll say, "Is this what you're looking for?" And it will kind of help you drill into that. So sometimes I've been like, "Oh, I don't even need a ticket. Here's the answer right here." Pretty quick turnaround time for responses when you do put in a ticket. I like uploading screenshots, to show exactly kind of what's going on. So super easy to do that. Closed tickets you can reopen or comment on. And then what's really helpful for us is sometimes we have folks who may be responding. I can look at tickets that my team have put in, so you can view tickets kind of across your practice and support your team members if you need to, which is really helpful.
Yeah, that's super valuable. Well, I'm gonna switch gears just a little bit, and I'd love to talk a little bit more about your experience actually on athenaOne, and maybe can you provide maybe some anecdotes about how the athenaOne mobile app, Athena Communicator, or other tools have improved your workflow compared to what was available in Athena Practice?
So Athena Communicator, I have to shout this one out. Just such a great tool to have in the toolbox. As the quality and population health leader in my organization for the past 6 years, being able to automate patient recall, outreach, gap closure campaigns with very limited staff takes a huge administrative burden off of our plate. Previously this was something that we had to outsource. We were paying additional fees on top of our EHR to be able to do this, and being able to pull that back and have that integrated within your system, being able to use that care gap list to kind of pull a list of people who are due for services and send them automated portal messages, phone calls, emails, being able to reach them after business hours when people are more available, maybe to hear a message or to kind of connect with a live operator and book that appointment that we're telling them that they're due for, is just so beneficial. We used Athena Communicator to do a colorectal cancer screening campaign. So we targeted patients based on age and documented family history. We pulled lists of patients who were due based on their open care gaps, and then patients who had documented family history of colorectal cancer. We limited that open gap list by age, and then we wrote specific scripts for 3 different populations. So folks who were turning 45, so coming due for the measure, folks who were kind of new 45 to 50, kind of that younger group, and then the family history group. And we were able to automate messages out to those populations during colorectal cancer awareness month, just remind them of early detection, importance of screening, how to talk about it with their provider. And that was like hours of work, took minutes. It was just so awesome. And then the insights dashboard have been a great resource for us. So we're tracking digital patient engagement as part of our front desk initiative. So we're monitoring that monthly. We are looking at provider and staff workload with the clinical insights dashboards, so we can monitor how new providers are doing, and like I said earlier, where they might need some additional support.
That's fabulous. And you kind of took a little bit out of the next question I was going to ask you, which is how have these AI powered tools within athenaOne helped improve the provider and the patient experience? And I guess I'd also be interested in how have these tools changed the way your staff interacts with patients or manages their daily tasks?
Yeah, so we certainly have reduced out of office working time, which is a huge driver of burnout. And we certainly were seeing that ahead of our transition. Providers were really feeling the pressure. Same day encounter close rates, those certainly help make sure, referrals can't go out the door without that encounter signed. So it helps our referrals team, when providers are able to close their notes quickly, get those patients connected to specialty care faster. Patients are able to view their visit notes, schedule appointments through their portal. So that helps with patient access. And it also, the front desk loves portal web scheduling because they don't have as many phone calls coming in for appointments. Patients are able to be, self-sufficient in that way, which is really helpful. And then it keeps those phone lines open for patients who really do need to talk to someone at the practice. And then
Yep, go ahead.
yeah, sorry, the communicator results call. So, we are a patient-centered medical home. We're required to let patients know about their results for lab and imaging. And so being able to automate that a little bit is super helpful for our clinical staff. They can focus more time on, really direct patient care.
Yeah, absolutely. And then I guess the last thing is, what about the feedback you've received from your patients in the community regarding some of these innovative features within athenaOne, and how have those tools specifically impacted their satisfaction and engagement?
Yeah, I think our patient satisfaction scores are in the high 90%. We're seeing lots of patients kind of start to engage digitally with a practice, which is awesome. I, will speak as a parent of a patient as well. My kids come to NOCO, and as a busy parent, it's super helpful to log into their portal and schedule their well visit, even if it's 9 p.m. on a Saturday when I remember, oh, they're due. I can go in and schedule that appointment, or I can send a picture of a form for school that I need filled out, or hey, doc, my kid's got a rash, what's going on here? I can send a photo of it right through the portal, which is super helpful. And I think that is certainly reflective in what we hear from our patients as well. They really like the ability to go in and kind of have that direct access to their health information. The portal is so much more user friendly, having been a user of our previous portal, very user friendly, very clean and simple, super easy to pay a bill online. We didn't have the ability to pay online before, so that has been really appreciated by our patients for sure.
You briefly mentioned earlier the insights dashboard, but I'm just curious, what about reporting?
So I mean, I think for us, we really struggled with reporting in Athena practice. The reports, the integrated reports module was, Crystal, which was really time consuming, difficult to learn. We just didn't have that in-house expertise. So virtually everything we did was external or done from a third party, which again was an extra cost. So with athenaOne, you have that ability to run those ad hoc reports with no complicated program to learn. It's really very simple. And if you are stuck, you can always ask your CSM for help and, or put in a ticket and get assistance that way. You can create reports, you can schedule them to be sent to you automatically, which is really helpful for us. I've got some standard reports I look at every month, and they just show up in my inbox without me even having to do anything. You can edit, if you build it and you're like, oh, that isn't quite right, you can always go back and kind of edit and filter. You can share them with other people on your team. And then the national quality reports, like HEDIS, the CMS ECQMs, UDS, PCMH reports, our previous system didn't have any of that. So you can really use this tool for that reporting. And then, in the past few years, we've really gotten the ability as practices to manage those program enrollments and how those things show up in the chart side to remind providers that, hey, touch on these quality items. We have the control of doing that now, which is just a great enhancement, has been really helpful for us.
Well, I'd love to just continue this focus on results on athenaOne, and I think that's really important. Something that we in the CS world wake up every morning thinking about how we can help our customers get better results. I'm wondering if you can share some examples of how athenaOne has led to some measurable improvements in patient care, provider satisfaction, or organizational efficiency.
Yeah, so digital patient statements, so patients who are electing to receive their statements electronically are up 5 percentage points in the past year. As I mentioned earlier, previously we had no way to accept online payments, and about 40% of our patient payments are made digitally now. We have earned, the past 2 years, we've earned Health Center Quality Leader badges from HRSA in silver and bronze because of the way that Athena surfaces those open quality gaps during encounters. It really supports staff in being more efficient and effective at chart prep and huddling. I think even the prep functionality within the chart just really supports our care teams and getting ready for appointments, makes those huddles more actionable. Providers really like having more autonomy over their documentation style and customizable templates, text macros, order sets. In our previous system, there was a lot. It was sort of very standardized. But now providers kind of have a little bit more stylistic control, which I think is really helpful for their own satisfaction. And then training courses for new users. I mean, we used to spend hours of staff time training new staff, both administratively and then on the clinical side when they made it to the floor. And so now staff learn the functionality from these modules that they have through Athena, and then staff can really help them with the workflow adaptation of that functionality, and do spend more time working on direct patient care and strategic tasks because they're not spending a whole day training somebody.
Yeah. Well, in speaking about time, let's talk about burnout briefly. I mean, I'm curious how the transition to athenaOne helped address issues of burnout among your staff and providers, especially in light of the increasing demand for value-based care.
Yeah, our providers have seen about a 30% average reduction in documentation time spent outside of business hours, which again I think is a huge driver of burnout among staff. Surfacing those actionable items for care teams before and during encounters, really streamlining documentation into that 5-stage encounter approach, allowing our providers to customize within guardrails, so they're not kind of soup to nuts building the whole system themselves, but they do have the opportunity to kind of, this is how I like to, this is the kind of language that I like to use, or this is the education that I prefer for this diagnosis. Being able to automate some of that stuff, they're not spending so much click time to kind of pull some of that data into the system. Our previous EHR was very click heavy in terms of our content. And so being able to kind of automate some of those simple repetitive tasks for them really frees them up to, to do the documentation and the key areas that they really need to. And then just being very data driven in terms of, what we need to focus on, looking at the system utilization, RCM. It's all data that's helping to improve this system, but also how we use the system to make things, better for them. In terms of value-based care, there's reporting on HCCs, suspect condition integration from payers, CPT2 coding. Those are all resources that we have used to support, our value-based payment initiatives. And so I think just making our care teams more efficient and effective in care delivery, and then RCM as well, being able to capture those elements that support VBP has been really key for us.
That's great. That's great. Well, thank you for your thoughtful responses, Jessica. Please stay with us just a few more minutes. And Tim, I'll bring you back if you could join us again, and we will bring up the questions that came through.
All right, I'm back. This has been great. We got a couple of really good questions in here. The first one, Jessica, you sort of hit on this already, but I'll see if you want to maybe add a little more. There was just a question of you sort of commenting on your view of the provider experience at your clinic.
Mm-hmm. Yeah, I mean, I think before on our previous system, providers were really feeling the pressure of increased documentation. The documentation was a little bit unwieldy. We were using documentation that was came from a third-party vendor and was very detailed. But I think providers felt a little bit overwhelmed by it. And so moving into a system that just has a much cleaner look, and again, that kind of streamlined 5-stage encounter, the documentation, like the flow of that visit was just so smooth. They really appreciated that. And we did have some performance improvement activities that we had done about streamlining visits and making, making them more efficient in the encounter and moving the encounters more quickly, because we were just spending so much time kind of clicking through radio buttons and checkboxes. And, now kind of on athenaOne, that documentation is really streamlined, and providers are able to move through encounter. Staff are able to move through encounter documentation so much quicker now, which has reduced our appointment, time that patients are spending in the exam room, which is really beneficial kind of all around.
Awesome. One other one for you, and then we get a couple operational sort of questions that I think I'm going to grab one and then send one to you, Ken. But just, vendors love to talk about partnering, right? But, can you talk truly, like, how do you view Athena as a partner and a collaborator with your community health center?
Yeah, I think Athena does a great job of listening to their customers, talking about prioritizing enhancements that are really going to benefit them. Even just allowing customers to say, hey, this enhancement would be great for us, and everybody else kind of voting on it, and then saying, all right, hey, people are really into this. Let's add that into the roadmap, or allowing customers to be able to have that transparency over, here's what we're testing in this system, and if you'd like to participate, let us know, and allowing customers to do that in those alpha and beta projects is really collaborative, I think. Very recently, New York State is working on a project right now related to health-related social needs screenings, and the state requires a very specific screening tool to be used in order for sites to be reimbursed for performing that. A lot of New York State sites said, hey, Athena, we know that you have the full screener and you have the partial screener, but New York wants something kind of in the middle. Could you please build this for us? And they said, yep, here you go. In your spring release, here it is for those New York State sites. So, I think that is a very recent, a very good example of, they really do listen to what the customer is looking for, and then they, guys put it into action.
Fantastic. That's super helpful. The next question I'm gonna take was a question about a customer out there who's hosted on Athena Practice today and wanted to know sort of what would that look like on athenaOne. And so the good news is it's going to look even better because athenaOne is a truly cloud-based single instance multi-tenant platform. You just need to get to the internet. That's it. So no servers. And though you're hosted today, obviously you don't have servers, but no VPN, none of that kind of stuff. No worrying about upgrades being dramatic in your organization, going forward. So there's a ton of advantages. Plus, being on this network, you're sharing information. Everybody's getting smarter by being, on that same network as we learn about, different information, be it revenue cycle rated, clinical, et cetera, et cetera. We share that information back to help everybody improve. So, and Jessica, anything you want to add to that, actually?
Yeah, I mean, we were in that same boat. We were a hosted customer on Athena Practice, and I think we also felt a little bit of that anxiety. You know, we had a great hosting partner that we really worked very well with, and so we were a little bit nervous. But yes, I would say those very painful weekend long upgrades, those don't exist anymore, right? So, and the uptime for us was a huge benefit, just because we were having so many issues with the uptime with our previous system. So, yeah, all good.
Thanks. And then last question I've got here, Ken, for you, it sort of rolls right into what we were talking about, quite frankly, is so when Athena comes out with new features and functionality, how do we communicate that out? How do we make sure that our customers are trained and ready to go?
Yeah, that's a great question, Tim. athenaHealth releases major updates about 3 times a year. It's a very predictable triannual schedule, which I really appreciate, and I think our customers do too. In fact, we just had our spring release a few weeks back in March, and at least 1 month prior to those releases, when we have new functionality, we publish a release center that provides all of the in-depth details and video guides and everything for upcoming changes. It's all sortable by staff position affected by those changes, which is really helpful. The product that's updated and the level of change management or training that may be required for each update. So it's really well done. For particularly heavy changes that require maybe a little bit more change management, just like some of the recent scheduling changes, for example, we send automated emails to practice staff who have been listed as responsible for training to make them aware of upcoming changes and resources that are available to them. Additionally, to further support clients during releases, we hold release walkthrough webinars to highlight key features that all Athena clients are able to attend or watch on demand. Our CSMs are provided with training and user guides, and then they can create that content with key features for their clients specifically. So it's customized to share with the client and their staff as part of their regular touch points. And of course, our user groups will also highlight and cover upcoming specialty specific changes and new functions as well when they meet. Lastly, one really cool thing we do, about 10 business days prior to our release, clients are able to begin testing key features in a preview environment. So they're able to ensure they're comfortable with changes or even make their own training videos for a more personalized approach for their practice. And I don't know, Jessica, if you have anything you want to add to that.
Yeah, I will just say also when you log into AthenaNet, kind of a little bit before the release, it actually will pop up and say, "Hey, your release is scheduled for this day," and you know your AthenaNet homepage kind of gives you those quick links just to get to that release center and to view those updates. And yes, the roadmap webinars kind of highlighting what's coming down the line, and then what is coming for this immediate release are always really helpful to view.
All right, awesome, awesome. So Jessica, I have just one final question for you before we wrap it up, and it is, what is the best advice that you can give other Athena practice customers as they consider making this critical change to their business?
Yeah, I think kind of understand why you're making this decision and set goals for yourself. What are you hoping to achieve with this change? And really identifying where are we now and where we want to be so that you can really measure that progress, making sure that your key team members, including those change champions at every level, are on board with this, and really make this a strategic priority. If you're moving forward, it is time and effort intensive, and really protecting the capacity of your team that's going to lead this work and make it a successful transition. But yeah, we are so happy that we made that change, even in a very difficult, kind of unprecedented time. It really ended up being such a great move for us.
Awesome. Well, thank you, Jessica, for all of your thoughtful responses. It was a pleasure having you join us for our panel discussion today.